By the end of this module, you will identify signs of escalating mental health crises, apply verbal and nonverbal de-escalation techniques, understand emergency thresholds requiring professional intervention, know the appropriate response steps for suicidal, psychotic, or panic-related episodes, operate within legal and ethical frameworks during a crisis situation. Mental health crises, unlike physical emergencies, often remain invisible until they escalate into dangerous or disruptive behaviors, suicidal ideation, or complete psychological collapse. The goal of this module is to develop non-clinical first responders with the tools, confidence, situational awareness, and techniques required to intervene safely, stabilize mental health crises, and initiate an appropriate support pathway. Crisis intervention requires not just quick action, but compassionate communication, an understanding of legal parameters, and proficiency in de-escalation methods grounded in psychology and trauma-informed care. This module also covers how to identify when a mental health crisis becomes an emergency requiring clinical or emergency services and how to act ethically, legally, and safely during such events. Defining a mental health crisis. A mental health crisis is any situation where a person's behavior or emotional state could put them or others at risk of harm, severely impair their ability to care for themselves, cause substantial disruption to functioning in public or professional environments, indicate imminent risk of suicide, self-harm, psychotic episode, or extreme emotional collapse. Mental health crises include, but are not limited to, suicidal thoughts or attempts, self-injury behaviors, aggressive, erratic, or violent behavior, acute psychotic symptoms, hallucinations, delusions, panic attacks or dissociative episodes, substance-induced mental breakdowns. Core principles of crisis intervention. Effective first aid in a mental health crisis relies on the ALGEE framework. A. Approach, assess risk, and assist with any crisis. L. Listen non-judgmentally. G. Give reassurance and information. E. Encourage appropriate professional help. E. Encourage self-help and other support strategies. Additional guiding principles include ensuring immediate physical safety for all involved, maintaining dignity and respect regardless of the individual's state, remaining calm, non-reactive, and emotionally grounded, acting without judgment and within legal ethical boundaries. Recognizing when crisis becomes an emergency. You must escalate a crisis to emergency services when there is an active suicide attempt or threat. The individual is unresponsive, catatonic, or severely disoriented. They are experiencing severe psychosis with dangerous delusions. There is violence or threats of harm to others. The person is in possession of weapons or illicit drugs. The person has overdosed or engaged in self-poisoning. In such situations, do not attempt to physically restrain unless properly trained. Call emergency services and provide accurate information. Do not leave the person alone unless you must ensure your own safety. De-escalation techniques. Verbal and nonverbal strategies. De-escalation refers to techniques used to calm and stabilize a person who is emotionally or mentally distressed. It must be done with cultural sensitivity, emotional intelligence, and trauma-informed awareness. A. Verbal de-escalation techniques. Use a soft, slow voice. Reflect and repeat their concerns. I hear that you feel unsafe. Avoid arguing, correcting, or criticizing. Reassure with statements like, "You're not alone," or "I'm here to help." Ask open-ended questions. Can you tell me what's going on? B. Nonverbal de-escalation techniques. Maintain safe distance, about 2 arms length. Keep hands visible and avoid sudden gestures. Nod slowly to show attentiveness. Avoid direct prolonged eye contact, which may be perceived as threatening. Position yourself at the same level, sitting if they're sitting. First aid actions in specific crisis scenarios. A. Suicidal crisis. Ask directly. Are you thinking about ending your life? Do not argue or attempt to shame. Remove access to means, if safe to do so. Stay with the person and call emergency help. B. Panic attack. Stay calm, speak slowly. Encourage deep breathing. In for 4, hold for 4, out for 4. Move to a quiet space if possible. C. Psychotic episode. Do not argue with delusions or hallucinations. Acknowledge distress. That must be scary. Minimize stimuli, low lighting, reduced noise, aggressive outbursts. Do not respond with raised voice or threats. Create space and remove potential weapons. Do not physically intervene unless trained. Legal, ethical, and safeguarding considerations. Understand data protection laws, e.g., GDPR, HIPAA. You may break confidentiality if life is at risk. Always document crisis responses, including time and nature of crisis. Interventions attempted. Who was contacted, e.g., emergency services. Avoid assumptions based on race, gender, religion, or mental health stigma.